name is Rajesh Yadav. I've done my Masters in Biotechnology from IIT Bombay. So basically my product is a DeoVent. This idea came from Center for Healthcare Entrepreneurship, a biodesign program of 1 year program. This 1 year we spent 6 to 8 months in hospitals, rural and urban area, where we saw more amount of patients from farmers and like other workers, those who have habits like smoking and BD. They're the person who came with respiratory problem. So what they usually have is one lung is infected more than the other. When one lung is infected more, the current technology they're using ET tube. This ET tube is giving same pressure to both the lungs, because of which our lungs are nothing but balloons. If you give more amount of pressure, it will have barotrauma, a condition in which there is bleeding inside the lung. To avoid it, we have come up with an innovative device called DeoVent, where 2 different pressure and 2 different volume can be given using this tubing. This tubing will be placed inside, and from here it will go to the left lung and the right lung. There is an opening over here, and it can be placed, and stiffness will be maintained throughout the process. Because of which, post ventilation, the patient will not have any kind of serious complications. This tubing is called double lumen tube. In this tube, you have 2 different openings, where one lung will hold to the right lung, the other part will hold to the left lung. So if I just blow it up, it will just blow it up, and then it will not move from here. So it will just hold on to the bronchia, and it can go to the left lung, and there's an opening from here which will go to the right lung. Using this device, you can give 2 different lung ventilation, which is possible. For rural people, those who are very poor, they cannot afford for this kind of technology. For them, it's very difficult to pay 25 lakhs for the device. The hospitals are not able to pay 25 lakhs. And for per day, a patient pays to roughly around 5,000 to 8,000 for this device. But we are providing it in a price of 500 per day. That's our aim, which we want to give it to the patient, rural patients who are there in India. This device is completely portable. A person can easily carry it. We have 2 different openings. There are knobs to control the flow rate and the pressure which comes out from the turbine. The turbine is made with a twin turbine mode. Each turbine will give a high RPM with less amount of power source. And this 2 different power source will help for the battery to operate, and we also in future have a plan to have a battery backup where we don't require by any chance. Currently around 15 rural hospitals didn't have electricity, and there were many cases where there's a death of the patient. To overcome that, we have a power backup also, which will help for the patient if there is any kind of current shortage. In our device, we have AI, that is artificial intelligence, where the sensors will be placed here, and each breath of the patient will be noted. And if by any chance there is any kind of complication in the device, it will give an alarm signal. Based on that, you can identify if there is anything wrong going on, and it will also give suggestion for what is going wrong. This data will be very useful for a low resource setting, where the nurses themselves can handle this device without the requirement of the pulmonologist to come into the picture.